The old age question arises, Doc, how long does fat live for? Well, as long as you do. Let me explain. We've heard of IVF, in vitro fertilization. Fat transfer is very similar to that. There are fertility docs that specialize in maximizing the percentage of successful egg retrieval in order to subsequently fertilize those eggs to produce a healthy offspring. Now, it's a numbers game. The docs that have a higher percentage are more reliable, more consistently able to produce a higher percentage of successful pregnancies, have better track records, better reputations, if you will. And it's very similar to fat transfer. Fat transfer, you see, is a living filler. Fat transfer, like egg retrieval, involves transferring very delicate cells from one part of the body and putting it into another. And these cells are not strong like biceps. They're very delicate. And so they have to be treated with kid gloves. They have to be harvested very delicately. We have to take it with very low pressure, often just with a syringe. The fat then has to be cleaned of inflammatory debris, such as collagen or blood, which would trick your body to make it want to attack the fat cells. And then the fat has to be put in expertly with an aesthetic eye into the targeted areas. And it has to be put in a very structurally sound way. I'm not just adding it as a filler, but I'm adding it also in certain vectors. They act as shock absorbers. They act as caissons, like reinforced concrete beams. And those help to elevate the areas in question so that we can get a lot more lift with less fat. So the results are often more natural with less of a puffy look. I think it's safe to say that on average, we're looking at about a 50% across the board survival rate. It is natural. It is a living filler. It can be very structural. So we're not just filling a hollow, a concavity, but by putting it in certain directions, we can provide lift, which is very strategic, utilizing what I call aesthetic engineering. Fat is also a good source of stem cells, and those stem cells are that gift that keep on giving. Patients will often notice maybe 8 to 9 months later that their skin is looking better, less pores, less discoloration, less blemishes, smoother. Yeah. And that has been attributed to the stem cells working their magic, producing their cytokines and various other growth factors that are beyond my understanding, and beyond a lot of other people's understanding for that matter, because stem cells still is a field of much hocus pocus. But we do know something is positive going on there. So to summarize, fat transfer, I've been doing this for over 30 years. It is a wonderful, invaluable adjunct to my surgical aesthetic practice. It's necessary because it provides very natural, permanent volume restoration, which as we age, we all suffer from volume loss. So part 2 of this video is going to highlight all the areas that fat could be placed and more. Thanks for watching, happy viewing, and hopefully you've learned something more today.